My name is Naim Fakih Gomez. I'm a consultant in bariatric, upper GI, and general surgery at the Chelsea Westminster Hospital as my NHS practice. I do surgery for overweight as well as for other conditions such as acid reflux and heartburn, and gallbladder surgery or other types of surgery such as hernia surgery. I was always inspired to try to help people, and actually I come from a family of doctors, and as a kid I grew up in that environment, which really inspired me. And that was kind of the main reason behind getting into this job. I've always wanted to be a surgeon from the early days of my medical school, and I then specialized in bariatric and upper GI surgery, mainly due to the fact that these operations were done minimally invasive, meaning keyhole surgery, and looking at how patients recovered in the early days compared to open surgery made me really get into that specialty, because mainly all these operations were done keyhole surgery. And this is something that I continued in my career, and I mainly perform the majority of my operations keyhole surgery nowadays, which have a major impact and benefit for patients and the recovery. I think the most rewarding part of my job is seeing the patients after the operation recovering safely and as smoothly as possible. We have a big focus on the recovery period, making it really smooth, having minimal impact and a great experience for the patients. As we understand, surgery can be quite, an anxious moment in every patient's life. I think what the patients value most from seeing me is the fact that I am open. I explain things, carefully, and make them part of the decision making. I always believe in shared decision making, as the patient is the one who understands, their, their necessities, uh, their, and I help them go through that process of understanding, their pathology, what's their problem, and the different options. And it is a shared decision, meaning that we both get to an agreement on what's best for them. And I value from my patients the trust that they have in me, and giving me the opportunity to explain things to them and inquiring about the specifics, which I'm always happy to get them through that journey. I mean, I've always believed in excellence, and that means that trying to get the best care possible. I like to give the care that I would expect for any member of my family, being looked after, and this is what I try to get to all of my patients.